5 medical interventions that reduce your risk of breast cancer recurrence. Every cancer survivor shares a common fear: recurrence. For most survivors, the fear of recurrence is a voice in their head that asks, what if it comes back? But thanks to extensive research, living cancer-free is more possible than ever due to post-surgical therapy. In this video, we'll touch on some post-surgical treatments, also called adjuvant therapies, which are designed to suppress the growth of cancer and reduce your risk of recurrence. But first, we'd like to thank our sponsor, Breast Cancer Index, a test that may help women with ER-positive, early-stage breast cancer decide with their doctors whether to extend or end anti-hormonal therapy after 5 years. Number 1. Radiotherapy or radiation. The most widely recommended treatment after lumpectomy is radiation. By targeting microscopic cancer cells that are undetectable during surgery, radiation kills future tumors before they have a chance to grow. Patients treated with radiation after surgery are more likely to live longer and are less likely to experience a recurrence. Research shows that women who underwent a lumpectomy without receiving radiation are at a 60% greater risk of developing cancer again. Radiation can be delivered by an external beam or by implanting a device into the affected breast. Both are reasonably well tolerated by patients and have similar effects. Number 2. Chemotherapy. Chemotherapy is no longer recommended for everyone. Patients who benefit the most from chemo include cases where cancer has already spread to the lymph nodes. Premenopausal women tend to have more aggressive cancers, so they may be candidates for chemotherapy as well. Also, women who are hormone receptor negative do not receive anti-hormonal therapy, which means that chemo may be their best option. However, there are many factors to consider with your doctor before deciding on a treatment plan. Fortunately, for women, there's a test that helps doctors determine if chemotherapy is right for you. Number 3. Anti-hormonal therapy. According to the American Cancer Society, about 2/3 of breast cancers are estrogen receptor positive. In this type of breast cancer, estrogen can fuel the growth of cancer cells. A pathologist evaluates your cancer cells to determine if your breast cancer is estrogen receptor positive. Anti-hormonal medication starves the cancer by either blocking the patient's estrogen receptors or by keeping her body from creating estrogen in the first place. These therapies act everywhere in the body, so cancer cells that have slipped beyond the breast can be targeted as well. Tamoxifen, a popular hormone blocker, is usually recommended for premenopausal women. What are known as hormone or aromatase inhibitors, such as anastrozole, exemestane, and letrozole, are often prescribed for postmenopausal women. Anti-hormonal treatments cause menopause-like side effects in many patients. And just like natural menopause, these treatments can affect women differently. The difficult question is, how long should a woman take anti-hormonal medicine? Finding the balance between the benefits and side effects is a very personal matter. The American Society of Clinical Oncology recommends that premenopausal patients be offered tamoxifen for a total of 10 years. However, they also recognize the need for physicians to weigh the risks and benefits of extended anti-hormonal therapy when considering duration of treatment for an individual woman. For postmenopausal patients, the guidelines recommend either 5 years of an aromatase inhibitor or offering tamoxifen for a total of 10 years. Be sure to ask your doctor about our sponsor, Breast Cancer Index, a test that predicts your likelihood of benefiting from extended anti-hormonal therapy based on the unique biology of your tumor. Number 4. Bone density treatment. Bisphosphonates are medicines designed to slow or stop bone tissue from dissolving, or what we call osteoporosis. The use of these medications by postmenopausal breast cancer survivors has helped resist metastases to the bone. A study of 11,767 postmenopausal breast cancer survivors concluded that those taking bisphosphonates experienced reductions in distant recurrence, in bone recurrence, and in death from breast cancer. The same study, however, showed no benefit for premenopausal women. Number 5. Vitamin D. Your doctor should monitor your vitamin D levels and prescribe supplements to deal with any deficiency. Although not widely understood, studies suggest that high vitamin D status is weakly associated with low breast cancer risk, but strongly associated with better breast cancer survival. Also, don't forget about weight management and exercise as other ways to prevent recurrence. Be sure to get approval from your doctor before starting an exercise routine. In another video, we'll discuss ways to limit the side effects of hormone treatments and suggest tools to support a longer, better life after cancer. To make sure you receive that video, please subscribe to our channel. Finally, we'd like to thank our sponsor, Breast Cancer Index. To find out more about your treatment options beyond year 5, just click the button and download our free list of 15 questions to go through with your doctor.